One of the best things you could do to help your brain function, and I'm relating this to some studies recently, new studies, because this has been information that I've been talking about for almost 30 years. But there's been some recent studies that say the number one thing that you can do, and I don't necessarily agree that it's the number one thing, but the studies say the number one thing you could do to decrease your risk of dementia and Alzheimer's is exercise. I would argue that it's probably diet. And honestly, if we want to get a little bit more granular about it, it's watch your sugar and alcohol intake. But the number one thing, the article said the number one thing you could do would be to exercise. And I want to go over why that is. Basically, movement, especially in the lower half of your body and your spine, stimulates weight-bearing joints, the nerve endings in your weight-bearing joints. When you stimulate the nerve endings in your weight-bearing joints, you actually create synapses, new synapses in your brain. This is called synaptogenesis. The biggest driver of synaptogenesis, creating new synapses, new connections in your brain, and maintaining those connections in your brain, the biggest driver to that is stimulation of your weight-bearing joints. So, exercise. It's not just exercise. It's getting out, walking, causing you to have a heel strike. What do we mean by heel strike? That's every time your heel hits the ground when you walk. Every time your heel hits the ground, that's a heel strike. Every time that happens, it's stimulating pathways to your brain that help you make new connections. So, you want to have a good brain later on in life? Stay moving, reduce your carbohydrates and sugars. Those would be my two biggest things, I guess. Anyway, hope you found that helpful. I'm Dr. Dave Morris of Magnolia Medical Center here in Murfreesboro, Tennessee. Stay healthy and be well.